Welcome to This Explainer. Look, if you're navigating a fertility journey right now, I know firsthand that it can feel incredibly overwhelming. There's just so much information out there, right? Figuring out what actually works for your specific body can sometimes feel like you're getting an unexpected crash course degree in pharmacology. But hey, that's exactly why we're here today. We're going to cut right through all that noise and give you a clear, highly structured look at what the science actually says about doctor-recommended supplements, and we'll be using some truly incredible source material from Progeny to do it.
Okay, let's dive right into this. So, what if optimizing your fertility literally started with your daily vitamins? I know it sounds almost too simple, but proactive nutrition is an incredibly powerful tool for anyone trying to conceive. We're not just talking about general wellness here. It is about specifically prepping your body at a cellular level for conception and pregnancy.
The medical backing for this is honestly incredible. A massive population-based observational study found that women taking multivitamins or prenatal vitamins actually had a much lower incidence of ovulatory infertility. Good nutrition doesn't just sit in the background quietly. It actively influences everything from embryonic and fetal development all the way to ultimately determining successful pregnancy outcomes. It's the literal foundation of the whole process.
Now, we're going to look at 13 different vitamins and supplements today, which I know sounds like a lot. But to avoid overwhelm, we've organized them into a super clear roadmap. We'll start with fueling your fertility, move into the foundational vitamins, then look at the antioxidant defenders, explore minerals, fats, and aminos, and finally wrap up with taking the next step. This is your roadmap to building a healthy reproductive environment from the ground up. Section 1. Fueling your fertility, the biological equation. Before we get into the specific vitamins, we kind of need to reframe how we think about fertility itself. It is absolutely a two-way street, a shared biological equation. I like to think of this as a double-sided coin, you know? Almost all the supplements we're going to discuss today benefit both halves of the equation. We aren't just talking about improving a woman's egg quality and ovulation. We're equally talking about optimizing a male's sperm count, motility, and DNA quality. Both sides matter equally here.
So, the crucial point here, and honestly the most critical ingredient, might actually surprise you. It's time. Specifically, 1 month. A large-scale randomized controlled study showed that women who started taking prenatal vitamins at least 1 month before conception saw a higher number of confirmed pregnancies and a significantly shorter time to conception compared to those who just took trace elements. You want to get these nutrients in your system well before you ever see that positive test.
Section 2. The foundational vitamins. Building the baseline.
Okay, so these are what we consider the absolute crucial basics for reproductive cell growth and maintaining a healthy hormonal balance. Let's look at the why for these foundational building blocks. First up, folic acid, or B9. The best form is methylated folate, and get this, it isn't just for women. Medical professionals highly recommend it for men too, to improve sperm quality. Next, vitamins B6 and B12 are essential for cell survival. Studies show they lower homocysteine levels, which is essentially a marker of inflammation in the blood, improving conception odds even for folks dealing with recurrent pregnancy loss. Then we have myo-inositol and D-cheryl-inositol. This combo is a total game changer for women with PCOS because it tackles insulin resistance and helps regulate ovulation. And finally, vitamin D. If you're deficient, pregnancy rates can actually drop. It's totally vital for healthy hormone development and again, improves semen quality.
Looking at the baselines, it's actually fascinating to see how folic acid requirements are basically identical for both men and women. These are the specific suggested amounts based on the clinical data. The main takeaway here is that building this baseline applies to both partners equally. It's a true team effort.
Section 3. The antioxidant defenders, shielding your cells. Let's move to the next level and see how this builds. You know, as we age, oxidative stress naturally damages both eggs and sperm. Think of oxidative stress like biological rust. The supplements in this category act as literal cellular shields against it. Take vitamin E, for example. And this brilliantly illustrates that double-sided coin concept I mentioned earlier. For women, it prevents cell membrane damage and boosts overall egg quality. For men, it boosts sperm quality and actually reduces DNA fragmentation when paired with vitamin C, which basically keeps the genetic blueprint intact. The data shows this is absolutely critical for patients over 35 who are trying to conceive. Then we have the broader shield. Vitamin C acts as a powerful free radical fighter, reducing cellular damage to counter ovarian aging. We already saw how great vitamin E is for cell membranes. But then there's coenzyme Q10, or Q10. This is a massive boost for women with diminished ovarian reserve, or those over 40. And it improves sperm concentration and motility in men. Lastly, selenium. This one is often viewed as the unsung hero. a fertility supervitamin. It generates glutathione to protect membranes and is absolutely essential for preventing early pregnancy complications like miscarriages. When you're figuring out optimal dosages for these, remember the main goal here. These defenders are all about preserving the quality of the reproductive material you already have. By maintaining these levels, you're effectively hitting the pause button on cellular damage for both partners.
Section 4. Minerals, fats, and aminos. Targeted enhancers.
All right, this is our final major group of supplements, and they address very distinct mechanical functions in the body. Things like blood flow, inflammation, and cellular signaling. Take zinc, for instance. Its biological impact is totally profound on both sides. For women, appropriate levels of zinc in the blood are associated with a shorter time to conceive and aid in fertilization. For men, a deficiency here can seriously stall the timeline for getting pregnant, leading to low sperm production. It is a key mechanical driver. These specific elements really fine-tune the body. Omega-3s, particularly those rich in DHA, fight body-wide inflammation and actually help women over 35 achieve pregnancy. Iron tackles ovulatory infertility directly. In fact, a massive study of 18,000 women proved that supplementing iron decreased this specific risk. And NAC, which is a really powerful amino acid, stimulates glutathione production to reduce chromosomal damage and vastly improve embryo quality.
Now, what's really interesting about this is that more power means more responsibility. So a massive word of caution here regarding safety. We have two other powerful amino acids, L-arginine, which boosts blood flow to thicken the uterine lining, and acetyl L-carnitine, which heavily improves sperm motility. But safety absolutely must come first. If you have a history of herpes, L-arginine can actually trigger an outbreak, and acetyl L-carnitine is totally contraindicated for anyone with hypothyroidism or a history of seizures.
As you digest this comprehensive toolkit, notice how the L-arginine doses are identical for both partners. But NAC requires a notably higher preconception dose for women. It's all about targeted tuning. I know this looks like a whole lot to process, but integrating these specific enhancers can make a world of difference in a tailored fertility plan.
Section 5. Taking the next step. Your fertility journey.
Okay, we've reviewed a literal mountain of clinical data. So let's ground this for a second. The most vital takeaway: supplements complement your diet. They don't replace it. You should always aim to get the bulk of these nutrients from real whole food first. Furthermore, as Dr. Sally Tazuk, a board-certified reproductive endocrinologist, advises in our source text, you absolutely must consult your fertility doctor before starting a regimen. Why? Because not all of these supplements should be continued once you are actually pregnant. Expert guidance isn't just a suggestion, it's mandatory. So what does this all mean for you? Which missing piece will you add to your fertility puzzle? You now have the knowledge to take real control of your reproductive health. Use this explainer as your launchpad. Write down the supplements that resonated with your specific situation, bring that list to your next doctor's appointment, and start building the best possible environment for your future family. Thanks so much for learning with me today.